Robin. I'm Kristi.
Hi.
How are you today?
I'm good, thanks. How are you?
Good, thank you. So I'll be your street massage therapist today.
Okay.
So I'm just wondering if you can fill out a quick health history form, and then I'll come back once you're complete, and we'll continue with the massage. Okay?
Sure, no problem.
Perfect. Thank you.
No problem.
So you filled it out?
I did.
Perfect. Okay. So I just want to go through everything just to make sure that we have it all filled out.
Sure.
So I see here that you have diabetes checked off. Is that correct?
Yep.
Okay. What type of diabetes is it?
It's type 1.
And how is your insulin injected?
I have an insulin pump.
Okay. When was your last reading?
It was about an hour ago.
Okay. And what was it at?
A 7.
Okay. Is there any other medications that you take other than your insulin?
Just Advil for the pain right now.
Okay. So we'll keep that in mind here. Is there anything else that you wanted to add?
Nope, that's it.
Okay. Perfect.
Okay, Tiffany, we're going to do the interview questions now just to get a better understanding of your injury and what's going on in there.
Okay.
So, have you ever had a contusion before?
Yeah, I did have one before earlier in the season, so probably about like 5 months ago.
And where was it?
Same area.
Same area?
Yeah.
Okay. Have you ever had any negative side effects from massage therapy treating a contusion?
I did have one massage the last time that I had my contusion. I just found it was a little bit painful when she got like close to the area, but other than that it was okay.
Okay, so we'll take that into account and make the adjustment.
Yeah.
Are you aware of any blood clots from the contusion?
No, not ever.
No, okay. And have you ever had a history of blood clots?
No, I've never had one before.
Okay. Have you had any medical attention or x-rays pertaining to the thigh since you've had this contusion?
Nope, no x-rays.
No x-rays? Okay. After your previous contusion, did you notice anything abnormal about either the feel of the muscles or your ability to use it and the extent of the ability before the injury?
I noticed that ever since it's a little bit of pain and restriction has lingered. Yeah.
So just like the lingering, like not what it used to be?
Yeah.
Okay. Do you have any other functional limitations?
Yeah.
So what does it keep you from doing on an everyday basis?
It's like rugby practice yesterday, even just like the light jogging, I found that I didn't have as much strength in my muscle. After about half an hour, the pain was too much, and then typically anything I have to walk or stairs or anything like that.
Walk or stairs, okay.
Yeah.
That's good to know. Were there any other injuries associated with this contusion?
No, not that I know of.
No? Okay. Are you taking any medications for the contusion?
I take Advil if the pain gets too much, but
Okay, but no like blood thinners or anything?
nothing like that, no.
Okay, awesome. And have you seen a doctor for it, the contusion?
No.
No, okay. Does it affect your sleep?
I find that I do wake up a little bit more through the night.
And what position do you like to sleep in? Is it preventing that position?
Oh, maybe, because
Yeah.
I like to sleep on my stomach, so it's probably when I roll over onto it that the pain wakes me up. Yeah, that makes sense.
And once it happened, when did you notice the swelling start?
I noticed it like a few hours after that it got like noticeable.
Okay.
Yeah.
And were you able to walk off the field after? Did you have to get carried? Did you continue playing? Like what happened?
I just kept playing.
You just kept playing. Okay. Awesome. Well, that's the end of the interview. So.
Okay.
Now I'm going to ask you some pain questions just so I can get a better understanding of why you're here today and what's going on.
Okay.
So, where is the pain?
It's just obviously where the contusion is, and then the whole area a little bit, but
Okay,
typically
mostly
there,
just
yeah.
where it is. And what caused the pain? What happened?
It was during a tackle in a rugby game, so I don't really know exactly what happened, but yeah.
It was a tackle.
Yeah.
Okay. And when did the pain begin?
So once the play stopped, I noticed the pain sort of like came on, and then it just progressively got worse as I was resting and just sitting
As
around.
you became more aware of it, kind
Yeah.
of? Does the pain move or refer anywhere? So does it radiate, travel anywhere? No. No? It stays pretty local to that spot?
Yeah.
Okay. And how often are you feeling this pain?
Whenever I have or do any activity, walking up the stairs and stuff like that, like I said before.
Okay, and then when you get this pain, how long does it last?
Until I rest, and then when I rest, it'll just throb a little bit because it's agitated, but that's...
Okay, so it's a different pain from using it to rest.
Yeah.
Okay. And on a scale of 0 to 10, so 0 being no pain at all, 10 being the worst pain you've ever felt, where would you say this pain would be?
If I use it or I strike it or hit it by accident or something like that,
yeah,
like a 7 or 8, but at rest around 2, 3.
Okay, so it changes depending. And what makes this pain worse?
Activity.
Yeah.
And hitting it, any excessive movement.
So touching it or what you're saying, like your functional limitations basically.
Yeah.
Okay. And what makes it better? What have you been doing to help relieve the pain?
Resting, and I've also been using some cold compresses sometimes, and then that will.
Awesome, okay. Yeah. And can you describe the pain to me, like both when you're striking it and at the rest?
So it's like throbbing when it like gets agitated, but at rest it's just kind of like a achy feeling. It's really dull.
Okay.
Yeah.
Any other symptoms or anything else you want to tell me about it?
No, not really.
That's it? Yeah. Okay. Perfect.
Okay, so I'm just going to do a posture analysis now. Is it okay if I palpate you? Just stand however is comfortable, okay? Okay, perfect. So now we're just going to do a gait or a walking analysis if you just want to follow me this way. Okay. So if you want to just take some steps towards me. So the first thing I observe is an absent heel strike due to an antalgic gait. As a result, your stance phase on the affected side is reduced, and your swing phase on the unaffected side is also reduced to limit the amount of time that you're weight bearing on the affected side, and therefore stride length and cadence are reduced.
Okay, so now that we've done the unaffected side, I want to move on to the affected side for all your ranges of motion. The first ones that we're going to do are the ones that I believe aren't going to cause you any discomfort when we do the movements. And then we'll move on to the ones that I believe might cause you a little discomfort. Is that okay?
That's fine.
Okay, awesome. So the first ones that we're going to do are going to be active, and they're going to be internal and external rotation. So I'm going to need you to do the same movements as what we did over here, and then I'll be measuring like we did on the unaffected side, okay?
Okay.
Okay. Okay, and go ahead and internal. Any pain?
No.
Okay, so it's about 10 degrees. Okay, and then do external. Okay, and that was about at 13 degrees. And then we'll do passive, so I'll do the movements for you. Let me know if there's any pain. Okay. Ready? Any pain?
No.
Any pain?
No.
Okay, so we're going to move on to the resisted movement now. So we're going to put you into mid-range.
Okay.
And then you're just going to resist against my pressure and let me know if there's any pain or discomfort, okay?
I will.
Okay, so mid-range and go ahead. So 1, 2, 3, 4, 5. 5, 4, 3, 2, 1. Any pain?
No.
Perfect, so that's a grading of 5. Then we'll put you into mid-range here. And go ahead, push up against my hand. So 1, 2, 3, 4, 5, 5, 4, 3, 2, 1. And I do notice an accessory movement, so we'll make sure to keep that in mind when we're doing our documents.
Okay.
Okay. Okay, so we're going to move on to the ranges of motion that might cause you a little pain or discomfort. So just let me know when the pain is, and we'll stop it.
Okay.
So the first one that we're going to do is active, and we're going to measure it just to make sure of what our angles are. And then go ahead into extension.
Yeah, that hurts.
That hurts there? Okay,
Yeah.
Whereabouts is the pain? You can relax.
It's localized to that contusion.
Okay, perfect. Because we didn't get into the full range of motion, that was an empty end feel. So with that, we did get a degree at about, it was about at 25 degrees.
Okay.
So then we'll do flexion of your knee as well. So go ahead whenever you're ready.
Yeah, that hurts a lot.
That hurts there.
Yeah.
Okay, and where's the pain?
In the same area.
Okay, now it's about at 10 degrees. So again, was an empty end field because we didn't get to our full range of motion there. So we're going to do flexion and extension in both passive and resisted now. So again, let me know when there's any pain and we'll stop. So is there any pain?
No.
Okay.
That hurts.
That hurts there,
Yeah.
and whereabouts is the pain?
It's localized.
Okay, perfect. So
Yeah.
then we'll move on to resisted again as well, okay? So we'll go about to mid-range, so can you hold yourself here? Okay, and then we're going to push into your leg and just hold it.
Okay.
Okay, so 1, 2, 3.
Yeah, that's sore.
That's sore?
Yeah.
Okay, so that one I would give about a grading of a 3. Just because you weren't able to hold the contraction.
Okay.
So I was able to put in a lot more resistance and you were able to bring back to me.
Okay.
So then we'll do it again with flexion. So push into my hand here. Go ahead. 1, 2, 3.
Yeah, that's sore as well.
Sore as well.
Yeah.
Okay, so that one I would give also about a grade of 3 just because we weren't able to get the full contraction.
Okay.
Okay?
Yeah.
So we're going to do some rule outs of your ankle as well as your hip. We just want to make sure that it is just your knee that has the issue. So they're going to be active movements and then with a little bit of overpressure, so let me know if there's any pain or discomfort, okay? So if we do dorsiflexion, so bring your toes to the sky, that is dorsiflexion. And I'm just applying a little bit of overpressure. Any pain?
No.
Okay, perfect.
So now I'm going to do some special tests just to reaffirm my hypothesis. So the first one I'm going to do is called the patellar tap test. So for this one, we're going to have your knee extended, and all I'm going to do is try to move your patella from side to side and up and down. And you actually do have a positive test here just because it feels like the patella is floating here. And what this means is you have some effusion or some liquid from the inflammation, so I think it's just gravity has pulled that inflammation downwards as we've gone. Okay? So now I'm going to do what's called the swipe test, and basically it's testing for that infusion or fluid in your knee again. So I'm going to start on the medial side, and I'm going to stroke up medially 2 to 3 times on your knee, just trying to bring that fluid up. And then I'm just going to move it across, and then back down that lateral side. And while I'm doing this, I do see here a ripple on the medial side, meaning there is that fluid or infusion. Meaning that that is a positive test again. So that's 2 positives for effusion in or around the knee, which again I think is just coming down from the contusion. Okay, so now that we've done those 2 tests, I'm just going to do one more just to rule out some more structures. And for that, I'm going to get you to... And what you're going to do, when you can, is grab this knee, pull it towards your chest while you're laying back onto that table, okay?
Okay.
So just grab that knee and slowly, just fall back. Good. And what I'm looking for here is you can test for hip flexors, but we're more worried about the rec fem or rectus femoris muscle. And this is a positive test just because the knee is not at 90 degrees or further, meaning that the rectus femoris muscle is quite tight or affected and doesn't. Thank you for filling out the lower extremity functional scale. This outcome measure is very useful because it can help track your progress and demonstrate to both you and I how much you are progressing over the course of the weeks and see if the treatment plan is working or if we need to make any adjustments. So as you can see, your initial score is 47 out of 80, so over the next couple of weeks we hope to raise that number and improve your functional ability. We will redo this test in 4 weeks to see if you have improved.
Okay, so now we're going to do a functional assessment. What this is just me looking at the movements that cause you pain exactly so I can see how you're dealing with them, where the pain is when you're doing them. So we already did a gait or a walking analysis, and you said that that caused you pain. So you've already assessed that. So the next thing I'm going to assess is your ability to drive. You said that that caused you a little bit of pain. I can just put this onto your foot here. And I'm just going to ask you to, as if you were driving, push down on the gas pedal. Let me know what symptoms you're feeling.
Okay. Hurts about here.
Yeah, is it?
Yeah.
The same feeling as extending
Yeah.
knee pain?
Yeah,
Okay.
exactly.
Okay, we can take that from you there. Next, what I'm going to get you to do, I'm just going to get you to show me a stance or movement in rugby. You said that practice was a little bit difficult for you. So if I could just have you stand up, please. Move this out of the way here. Okay, so now, yeah, I'll just get you to do some kind of stance or movement that you're typically doing in rugby that you think you're going to have problems with in your recovery.
Okay. It hurts, but about here.
Yeah, okay. And is that more of a same pain or stretch pain?
Kind of a little bit of both.
Yeah?
Yeah.
Okay, okay. Watch you go up and down the stairs next. Follow me this way. Okay, so now I'm just going to have you go down the stairs, please, carefully. I'd like to just see what's going on here. Perfect, you can follow me back to the room.
Here is our impairment chart for Tiffany. I'll go into more detail with why we chose the impairments and the techniques as we do them. However, there were 2 articles posted, one in AMJ Sports Med as well as one by Crane J.D. et al. In the Science Traditional Medicine Journal, which both demonstrated how when someone has a contusion, massage, especially using techniques like these, can help to reduce inflammation and promote mitochondrial biogenesis, overall leading to faster recovery times. We are also going to keep in mind her contraindications, which include the contusion itself as well as her insulin pump, and for this we are going to change her positioning as well as the pressure of our techniques, and we'll also keep in mind her reassessment date, which is on August 15th, 2017. To make sure that you don't have a blood clot, I'm just going to do a quick test, okay?
Okay.
So I'm just going to squeeze the calf. Did you have any pain there?
No.
Awesome. So we are all good. Tiffany, so it's time to get you on the table. I want you to undress down to your comfort level. However, skin-on-skin contact is the best, so whatever you feel comfortable with. And I want you to get into a supine position, so that is on your back. And I want you to get in between these sheets, okay? And then cover yourself back up when you get on here, okay?
Okay.
All right, I'm gonna go wash my hands, and I will let you know when I'm ready to come back in just to see if you're ready.
Okay.
All right, Tiffany, how are you doing?
Good, thanks.
Are you comfortable?
Yes.
Are your pillows in the right positions?
Yes.
I'm just going to start with some static contact, making sure I'm not touching the contusion itself, just so you can get used to my touch. All right, now I'm going to undrape your leg for you. Is that okay?
Yep.
All right, how does the drape feel?
Good.
Do you feel secure?
Yes.
All right, so I'm just going to start off with some fine vibrations, hopefully to try to reduce some of that pain, okay?
Okay.
I'm going to start here. I will not touch your contusion. And how's that feeling?
Fine.
Okay. So again, this hopefully just reduces some of your pain and gets you further used to my touch. Okay?
Okay.
And for this to be really effective, you have to do it upwards to around 30 minutes, which is quite a long time. Alright, so now that I'm done with the fine vibrations, I'm going to move on and do something called manual lymph drainage. And basically what that's going to hopefully do is reduce the edema or the fluid that has built up because of that contusion. In order to do that, I'm going to pump over here because this is just the main terminal on this side of the body. And then I'm going to pump back on that underwear line. Is that okay?
Mm-hmm.
Would you prefer your hand there, or is my hand okay when I'm pumping down at the underwear line?
Yours is okay.
Okay. One last thing while you're in this position is that I'm going to go over some diaphragmatic breathing, because this is a really good thing that you can also do as home care, and it helps to reduce that stress, which will also reduce some pain. So I'm just going to put my hand on your stomach, and I want you to really breathe through your stomach, trying to get my hand to the ceiling, okay? So breathe in for a count of 5 for me, please. 1, 2, 3, 4, 5, and good, and breathe out. 1, 2, 3, 4, 5, 5, good. So you would just keep repeating that, and hopefully that will relieve some stress for you, okay?
Okay, Tiffany, so now we're just going to do some techniques just to loosen up the muscles around the contusion that have guarded and spasm, just to protect the area.
Okay.
Just going to do a little bit of work on your tendon, hopefully relieve some of that tension in the actual muscle that has the contusion in it.
Okay.
You know, if you feel uncomfortable at any time, I'm going to do it over the sheet. I'm just going to bow that tendon slightly. I'm just going to hold that there. So now we're just going to do some fascial work on some of the structures that have been really tense,
Okay.
because of how you've been walking and everything, to compensate for this. So we'll just get you to change positions now.
Okay, so now that we've done that massage, we're going to get you to lay sideline. So I'm going to drape you back up, and then we'll just roll you over so that you're facing the wall, okay? And then I'll be working on the other side of you, okay? So I'm just going to cover you up. For the techniques here, we're just going to do, actually I'm just going to tuck that up a little bit higher if that's okay. Okay, so for this one, we're just going to assess the skin first, and then we'll warm up the tissue so that when we do our techniques, they're not going to overwork anything. And then by warming them up, they'll be engaged, so that we'll get a better response from you, okay? So I'm just going to assess your fascia just to see any movement. Because you don't have great movement in your skin, so you're definitely compensating for your other leg, what their contusion is. So by performing these fascial techniques, we'll be able to loosen up your muscles in your skin, just so that you get better ranges of motion and everything, okay?
Okay.
Okay, so now that we are warmed up, I'm just going to do some skin rolling. Let me know if it gets above your pain tolerance at about a 7. If it does, then we'll stop and modify it, okay?
Okay.
You okay?
Yeah.
Just gonna finish flushing here, and then we're going to do a couple more techniques. I'm just gonna move over onto the other side, okay? So we're just gonna do some myofascial release. So we're just gonna be pulling apart your skin tissue, just so that we can get a little bit more of a stretch in it, so that you can have more movement. So we're going to do it on your hamstrings here. So we hold it until we get a little bit of give from your skin. Okay, so we're just gonna do some direct glide now, okay? So it's just superficial to touch and it is a little slow, so it does take time to get through it, okay? Still doing okay? Okay, so I'm just gonna flush.
Just gonna locate a trigger point. And with a trigger point, it's really important that you give me feedback because we don't want to go over your pain tolerance, okay?
Okay.
So we're gonna set a pain scale of 7 to 10, out of 10, sorry. And I don't want you to go over a 7 out of 10, okay?
Okay.
So you just let me know. So now I'm just gonna strip because I found a top band and this will help me locate the specific area of that trigger point. Are you okay?
Yeah.
Again, remember that between the 7 out of 10, or sorry, no higher than 7 out of 10. Okay, so I found this top band and I need you to let me know if you feel any of these things. So tenderness within this top band, a twitch response, and autonomic phenomena, so such things as sweating, goosebumps, runny nose, teary eyes, or referral pattern up into that lower back area, okay?
Okay.
So let me know.
Yeah.
Do you have a referral
there.
pattern right there?
Yeah.
Okay, so there's the trigger point. I feel that little nodule and twitch response. So I'm just going to do some direct compressions right on that, okay?
Okay.
So I'm just going to press deep. And I could hold this up to 30 seconds or until I feel it release, okay? You doing okay?
Yeah.
Awesome. All right, has that referral pain disappeared or relieved a little bit?
Yeah, it's less.
Okay, awesome. So okay, are you okay for some heat now?
Yeah.
Okay, so we're just gonna apply this heating pad just to that whole area that I just worked, and I'm just gonna put it on. It's gonna be warm. Make sure there's a barrier. Put it on, and I'm just gonna do a quick spot test. Is that okay? It's not too warm?
No, it's good.
Okay, it feels okay. So I'm gonna leave that on, and I'm gonna come and work on a different part of your body, and I'm just gonna check on that every 5 minutes, okay? Just to make sure that it's not getting too warm and your skin's okay underneath there. Alright, so it's been 5 minutes, so I'm just gonna do that first initial check. How's the heat feeling?
It's still good.
It still feels alright. Okay, so leave it on, and we leave it on for about 15 to 20 minutes, and now, does it feel still good?
Yeah.
Alright, I'm just gonna remove it, and I'm gonna stretch you out, okay?
Okay, so now that we've done the treatment, we're just going to run through the ranges of motion again, just the ones that were causing you any pain or discomfort. So the flexion in all of the ranges in the active, passive, and resisted. And then in extension, we're just going to do the active and resisted, okay?
care now, just so that you can help your progress and rehabilitation along at home. So first of all, the diaphragmatic breathing, which we went through in your treatment. So you can do that anytime that the pain gets too much to handle, just to deal with the pain.
Do you need another demonstration?
I'm okay.
That's okay.
Mm-hmm.
Our second thing is hydrotherapy. So I'd like you to put cold on your leg. Cold is supposed to help with inflammation and swelling and also the pain. An article published in 2006 in the Medicine and Science in Sports and Exercise journal, Lee et al. Actually claimed that cryotherapy, which is like cooling to like 27 degrees Celsius, may be useful in reducing the inflammatory response without reducing blood flow to all the tissues in that surrounding area, and that's exactly what we want. So I'd just like you to use a barrier, so either take a cold pack, wrap it in a towel or something like that, or over clothing, and just put it on the swollen area for about 10 to 20 minutes, depending on your comfort level. And I'd like you to do that, if possible, about 2 to 3 times a day, and do that until you see the swelling start to decrease. So that's the second thing. Do you have any questions about that?
No.
So it's just the cold, 10 to 20 minutes, 2 to 3 times a day. And the last thing is just some active ranges of motion, kind of like what we did for the assessment and reassessment, just to help keep the area from developing fascial adhesions. That's like the last thing that we want. We want to keep it moving, that way we can get you back to playing rugby and everything as fast as possible. So just to show you what that would be like, so you could just lay on your back for me, please, and thank you.
To help with that range of motion, you just want to, you can do deep diaphragmatic breathing while you're doing it. You just want to let your knee drop to the table as much as possible. So you can do this laying in bed, you can do this laying on the couch watching TV. Anytime that you think about it where your leg is in an up position, you can just take some really deep breaths and think about dropping that knee down to the table so you can start to get that range back. And if you'd like to roll over onto your side, just roll onto the side here. Yes, yeah. The next one is flexion.
So that's your 3 pieces of home care. Do you have any questions?
Nope.
Well, thank you for coming and for your trust today. I'll just walk you out now. You can follow me this way.
Thank you.